Have you ever noticed an elderly loved one scratching their body repeatedly and thought it was just dry skin or a harmless habit? It's easy to overlook these signs, but did you know that persistent itching in certain areas could be a warning sign of something more serious? In this video, we're going to dive into 5 specific areas of the body where chronic itching might indicate a deeper health issue. Whether you're a caregiver, a family member, or someone concerned about aging health, this video will help you recognize the early warning signs that could make a big difference in treatment outcomes. By watching until the end, you'll not only understand why these itchy spots matter but also learn when it's time to seek medical attention, something that can often be overlooked until the issue worsens. Knowledge is power, and by being proactive, you can improve the health and quality of life for your elderly loved ones. So stay tuned and let's explore these crucial health signals together. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Let's start with the first area where itching could be a warning sign: the lower legs and feet. For many elderly individuals, itching in these areas may seem like a normal, age-related occurrence. However, it's crucial to pay close attention to these symptoms, as they can sometimes signal more significant health concerns. When elderly individuals start scratching their lower legs and feet regularly, their bodies may be trying to communicate something important about their circulation or overall health. One of the most common causes of itching in the legs and feet for older adults is poor blood circulation. As we age, our circulatory system becomes less efficient, meaning blood doesn't flow as freely or as effectively, especially in areas farther from the heart, such as the lower extremities. When circulation is impaired, certain parts of the skin, particularly on the legs and feet, may not receive the essential nutrients they need. This lack of nourishment can lead to skin dryness, which in turn causes irritation and persistent itching. In addition to the itching, you might notice some noticeable changes in the appearance or feel of the skin. For instance, the skin may take on a purplish or bluish hue, which could be an indication that blood is not circulating properly in that area. The skin might also feel colder to the touch than the rest of the body, a common sign that blood flow is restricted. These symptoms can be quite alarming, especially when they persist over time. What makes this issue particularly concerning is that poor circulation is not just a matter of comfort or nuisance. It can be a sign of more serious underlying health problems, such as heart disease or blocked blood vessels. In some cases, poor circulation may also point to issues with veins or arteries, leading to conditions like peripheral artery disease, PAD. These conditions, if left untreated, can worsen over time and lead to more severe complications. If an elderly loved one is constantly scratching their legs and feet, especially if they are also experiencing discomfort, swelling, or a feeling of heaviness in their legs, it's essential to take these signs seriously. Leg fatigue or cramping, particularly when walking or standing for extended periods, can further indicate circulation problems. These symptoms may seem mild at first, but they are often early indicators of circulatory issues that require medical attention. This is even more important if the elderly individual has underlying health conditions such as diabetes, high blood pressure, or a history of heart disease. These conditions can exacerbate circulation problems and make the body more vulnerable to complications like blood clots or vascular damage. For individuals with diabetes, the risk is even higher due to the potential for nerve damage, neuropathy, and poor wound healing in the feet. If these signs of poor circulation, such as persistent itching, leg discomfort, and changes in skin color or temperature, are present, it's crucial to seek professional medical advice. A doctor can assess the individual's circulatory health, run necessary tests to check for conditions like PAD or blood clots, and recommend treatments to improve blood flow and overall health. Early intervention can help prevent more serious complications down the line, ensuring a better quality of life for your elderly loved one. Moving on to our second crucial topic, let's delve into the seemingly mundane yet highly informative subject of itching at the back of the neck. While this symptom might initially appear trivial, it can often serve as a window into deeper health issues, especially when observed in elderly individuals. Persistent neck itching should not be dismissed as merely an annoying quirk. Instead, it may be indicative of underlying conditions that warrant further investigation. In older adults, frequent scratching or itching in the neck area can sometimes be traced back to nerve or spine-related complications that develop with age. Consider the everyday actions that contribute to neck strain. Prolonged periods of looking down at smartphones, reading books, or sitting for extended durations. These habits can lead to poor posture, which in turn puts undue pressure on the cervical spine and the network of nerves that traverse this region. Over time, the cumulative effect of these daily stresses can cause irritation or compression of the nerves, resulting in a persistent itch. Moreover, the sensation of itching might not occur in isolation. It is often accompanied by other symptoms that provide critical clues about the underlying condition. For instance, one might also experience headaches, difficulty in turning the head, or even a tingling sensation that radiates down the arms. Such a combination of symptoms may suggest that there is pressure on the neck nerves, a scenario that is commonly associated with conditions like cervical spondylosis, arthritis, or other spine-related disorders. These ailments are particularly prevalent among older adults, where natural wear and tear, along with degenerative changes, can exacerbate the discomfort and lead to more serious complications if not addressed promptly. It's important to recognize that these symptoms are not merely nuisances but potential red flags indicating that something more significant may be affecting the spinal health. Early detection and treatment are crucial. Medical interventions may range from simple lifestyle adjustments, such as improving posture and reducing screen time, to more involved treatments like physical therapy, medication to relieve inflammation, or even surgical options in severe cases. A healthcare professional can perform the necessary evaluations, such as imaging tests or neurological assessments, to pinpoint the exact cause of the discomfort and recommend an appropriate treatment plan. The third area to address is the chest and upper torso. When older adults experience, I'm describing the importance of chest and upper torso itching in older adults. It may signal heart or lung issues, with varying blood flow or communication from the body. Recognizing patterns. It's interesting to see that mild recurring itchy sensations, especially in the chest and upper torso, might be a gentle health warning, which is crucial to watch closely. Taking a closer look. It's interesting to see that if itching persists or worsens, consulting a doctor is crucial to rule out health issues. Elderly patients might overlook these symptoms as typical aging signs. The third area to address is the chest and upper torso. When older adults experience itching in this region, it's important to take it seriously and seek medical attention. This is not just about uncomfortable dry skin. Unusual itching or tingling in the chest can sometimes serve as an early warning sign of underlying heart or lung issues. Before more recognized symptoms such as chest pain or breathing difficulties appear, the body might first signal distress through sensations like intermittent itching or a persistent tingling feeling in the chest area. Such sensations could be attributed to variations in blood flow or even subtle shifts in the way the body communicates internal stress. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. In many cases, the itching might occur intermittently, particularly during periods of physical exertion or when the body is under stress. For example, if an older adult experiences itching that seems to coincide with their exercise routine or moments of heightened emotional tension, it is a signal that something may not be functioning optimally. If the symptoms seem to resolve and then reappear, especially during activities that naturally increase heart rate and blood pressure, it is advisable to consult with a healthcare provider. Similarly, if you notice that a loved one scratches their chest more frequently at night or when they are lying down, this behavior might not merely be due to discomfort from dry skin. Instead, it could be indicative of breathing difficulties, as the posture assumed while lying down can exacerbate respiratory issues that might otherwise be unnoticed during the day. The gradual onset of these signs is what makes them particularly concerning. Often, mild or occasional itching is dismissed as an ordinary nuisance or attributed to aging-related dryness. However, when the symptom becomes a recurring event in a specific area like the chest or upper torso, it's as though the body is attempting to alert you to a more significant issue. Observing patterns is crucial. Note if the itching intensifies at certain times of the day, if it accompanies other physical changes such as swelling or discoloration of the skin, or if it is associated with discomfort or a feeling of tightness in the chest. Such patterns can provide invaluable clues about whether the underlying cause might be more serious than initially assumed. For caregivers and family members, understanding and monitoring these patterns is essential. While simple interventions, such as regularly applying moisturizers, switching to gentler, hypoallergenic soaps, or opting for looser, more breathable clothing, can sometimes alleviate symptoms of dry skin or irritation, they might not be sufficient if the itching persists or worsens. Chronic, unrelenting itching warrants a thorough medical evaluation. A doctor can perform a series of tests to determine if there is an underlying health issue, such as compromised cardiac or pulmonary function, that requires immediate attention. It's also important to consider that many elderly individuals may not report these symptoms themselves. They might assume that frequent itching is simply a normal part of aging or feel embarrassed about discussing it. Therefore, caregivers and family members must initiate conversations about these symptoms. Asking gentle, open-ended questions can help bring these issues to light, ensuring that any potential warning signs are not overlooked. Recognizing that the body often communicates its distress long before more severe symptoms develop can lead to early intervention, which is key to managing any underlying health problems effectively. If you care for an elderly relative, sharing your experiences and observations can be incredibly helpful to others in a similar situation. Have you noticed patterns in when the itching occurs, or do you see any accompanying symptoms such as swelling or discoloration? Your input might help raise awareness and encourage others to pay closer attention to these warning signs. Feel free to leave a comment or share your story, as community support and shared knowledge are invaluable when it comes to early detection and intervention. Now, having explored the importance of monitoring the chest and upper torso, let's move on to the next section. We will examine two additional crucial areas where itching in older adults can serve as an alarm sign. Areas that also require specific attention and prompt evaluation to ensure overall health and well-being. The fourth area we need to address is the hands and wrists, which are incredibly important parts of the body that we use frequently throughout each day. As we age, changes in these areas can signify more than just the natural effects of aging. They could point to underlying health issues that require attention. Our hands and wrists play a crucial role in almost everything we do, from eating, writing, and handling objects, to even resting in our laps. For older adults, experiencing itching in the hands and wrists could be an early sign of something that needs further exploration. While it's easy to brush off itching as a minor inconvenience, it's important to consider the broader context of how these areas are used daily. When older adults experience itching, it's more than just dry skin. It could signal something more complex, such as joint health issues or problems with circulation. Itching, especially if it occurs regularly or is persistent, may precede pain or stiffness in the joints. One early indicator that may go unnoticed is when itching becomes more intense during or after certain activities that require the use of the hands. If you notice your loved one scratching their hands or wrists after engaging in tasks like writing, crocheting, or using utensils, this could be a subtle sign that there's something more going on beneath the surface. Itching in these areas, especially when it intensifies with use, may be associated with conditions like arthritis or even nerve problems. Itching accompanied by a burning or tingling sensation could indicate nerve tension or compression, which often affects the wrists and hands. This combination of itching, burning, or tingling should be taken seriously, as it can point to underlying nerve issues that require medical evaluation. The importance of addressing hand and wrist irritation cannot be overstated, especially as we age. These are the tools through which we interact with the world, and if an older adult begins to avoid activities due to hand or wrist discomfort, it can have a significant impact on their overall independence. They might stop doing the things they love, avoid social interactions, or even struggle with daily essential tasks like dressing, eating, or grooming. Over time, this can lead to a loss of self-sufficiency, emotional distress, and a decline in quality of life. That's why it's so critical to monitor any persistent itching or discomfort in the hands and wrists and to seek professional advice when necessary. Early intervention can make a world of difference in preserving function, comfort, and independence. So, if you observe any signs of discomfort, irritation, or changes in skin condition around the hands and wrists of an elderly loved one, don't hesitate to reach out to a healthcare provider for further evaluation and guidance. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. The 5 areas to address are the lower back and hips. This region is often affected by itching, and many older adults may not bring it up to their doctor, either because they don't want to bother them or because they don't recognize it as a sign of a health issue. It's essential, however, to understand that itching in the lower back or around the hips can be indicative of various underlying health conditions that deserve attention. One potential cause of itching in the lower back and hips is related to kidney issues. Our kidneys play a crucial role in cleansing the blood by filtering waste and excess fluids from the body. When kidney function begins to decline, it can lead to a buildup of toxins in the bloodstream, which can result in itching throughout the body, including the lower back and hips. If you notice your older loved one frequently scratching or rubbing this area, especially if they are also exhibiting signs of fatigue, changes in bathroom habits, or an increase in the frequency of urination, it might be time to consult a healthcare provider. These signs could indicate that their kidneys require a medical evaluation, and it's essential to address these symptoms before they lead to more severe complications. Another reason to be mindful of itching in the lower back and hips could be related to nerve abnormalities in the spine. As we age, the bones in the spine may start to press on nearby nerves, causing unusual sensations such as itching, tingling, or even pain. This can be particularly troublesome when older adults remain seated for long periods, such as when watching TV or reading, or even after a night of sleep. If your loved one often complains of itching or discomfort in the lower back after sitting for a while or when they wake up in the morning, it may be a sign that nerve compression is at play. It can also cause stiffness in the limbs or a sense of tightness in the back, further contributing to their discomfort. The lower back and hips pose a unique challenge for older adults, primarily because it can be difficult for them to reach this area to apply lotions or creams that might help alleviate the itching. This can lead to persistent irritation, and without proper care, the area can become sore or inflamed. It's vital to assist them with their personal care routines and ensure that they're able to maintain proper skin hygiene and moisturization in this region. If they frequently try to scratch or rub their lower back, either by using furniture or back scratchers, take this as a signal that they may be in discomfort and unable to address it on their own. While it may seem like a minor issue, persistent itching in this area should not be ignored. It could be an early sign of a more serious condition that requires medical attention. It's always better to err on the side of caution and consult a healthcare professional to rule out any underlying problems. In addition to simply providing comfort and relief for the itching, a doctor can help diagnose any possible causes, whether it's related to kidney function, nerve compression, or another health issue. When it comes to itching, it's important to note that we're not just talking about the occasional scratch. The duration of the itching, its frequency, and whether it is accompanied by other symptoms are all factors to consider. While some itching can be a natural part of aging, especially when skin becomes dry, it's the persistence and accompanying symptoms that often signal that there might be something more going on. If the itching worsens over time, doesn't respond to basic skincare treatments, or is accompanied by other signs like fatigue, changes in bathroom habits, or pain, it is crucial to seek professional guidance. Now that we've examined this particular area of concern, let's turn our focus to how we can better support our elderly loved ones when they show these symptoms. In the next section, we'll discuss practical steps you can take to help alleviate discomfort, and more importantly, when it's appropriate to seek medical attention to ensure they are receiving the care they need. Now that we've taken a closer look at 5 crucial areas where itching can provide valuable clues about health in older adults, let's explore how we can make this information truly beneficial. After all, knowledge only becomes powerful when it's actively applied. So, take a moment to think about your elderly loved ones. Have you noticed any persistent scratching or itching in the areas we discussed today? While it may seem like a simple, harmless habit, scratching could be a signal from their body trying to communicate something important about their health. It's essential not to dismiss these potential warning signs, as they might represent early indicators of underlying health issues that, if addressed promptly, could prevent more severe complications in the future. As caregivers, one of the most powerful things we can do is to stay vigilant and pay close attention to these small but significant changes in our elderly loved ones' behavior. Observe their habits and look for any patterns, such as scratching more frequently at particular times of day, or after specific activities like bathing, eating, or even during certain weather conditions. This awareness can help you understand the underlying cause of their discomfort and make informed decisions on how best to address it. Additionally, be mindful of any other changes in their physical condition, such as noticeable shifts in skin color, unexplained swelling, or a sudden increase in fatigue or weakness. These subtle signs can often be interconnected, giving you a more complete picture of their overall health. Let's revisit the 5 key areas where itching may indicate a potential health concern. The legs and feet, the back of the neck, the chest and upper torso, the hands and wrists, and the lower back and hip area. If you notice persistent itching in any of these regions, it's crucial not to wait too long before seeking medical attention. Early detection is always the best strategy when it comes to elderly health. Whether the cause is something as benign as dry skin or as serious as a circulatory issue or a sign of systemic conditions like diabetes, a simple visit to the doctor can make a world of difference. Remember, when it comes to our aging loved ones, It's always better to be cautious and proactive rather than risk overlooking something that could escalate. As we continue this conversation, I'd love to hear from you, our viewers, about your experiences in caring for elderly family members. How old are you, and where are you watching from? Your age and location can offer valuable insight into how elderly care is approached and experienced around the world. Sharing your story in the comments section not only helps build a sense of community but also provides support to others who may be navigating similar challenges. If you found this information helpful, please take a moment to give the video a thumbs up. It helps us reach more people who may benefit from this knowledge, and if you haven't already, don't forget to hit the subscribe button and activate notifications. We regularly post tips and insights on elderly care that can make a meaningful impact on the lives of both caregivers and the elderly. Being a caregiver is a demanding and often emotional journey. But remember, you are not alone. Many of our subscribers are going through similar experiences, and this community exists to support one another. Leave a comment below with your age and location, and let us know which of these signs surprised you the most. Have you noticed any of these warning signs in your elderly loved ones? Your experience might be the exact support someone else needs, and together, we can navigate this journey with greater understanding and compassion. Thank you for watching until the end. Now that we've covered these essential signs and discussed the potential implications of chronic itching in specific areas, I'm curious. What have you learned so far? Share in the comments one key takeaway that you'll put into practice to help care for yourself or your loved ones. Your insights could make a real difference in someone else's life. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more important tips on elderly care and health. Stay informed, stay healthy, and I'll see you in the next video.